I mean, many of the challenges that face us in treating thoracic malignancy or introducing new drugs for treating our patients with thoracic malignancy are common to many other tumour types. The need for good clinical trials, the fact that there are now so many potential therapies out there, so many drugs needing clinical trials, the fact that many of the new drugs are targeting a very small niche of patients, which makes recruitment of patients into a clinical trial, and indeed the conduct of a clinical trial in a traditional sense, very difficult, because it can take a long time to recruit a large enough number of patients to achieve a statistically significant or a statistically meaningful data set. In addition, when using new therapies in early disease, it takes a long time for the trial to read out. You have to wait 5 or more years before you have meaningful data. In terms of the biomarker testing in lung cancer, one of the biggest challenges we have is just the availability of material to conduct the biomarker test, because our lung cancer samples are particularly challenged in terms of the amount of material we have to work. When you compare what my colleagues who work in other tumour types have, I'm always very jealous of the amount of tissue material that they have to work with in comparison to what I have to work with. But you know, we have new technology and we have strategies to try to make things better. But those are at least some of the challenges that we face in the lung cancer world.